The two most common types of Medicare Advantage plan are PPO and HMO. Let's talk about PPO. As a member of a Medicare Advantage PPO or Preferred Provider Organization plan, you also have access to a network of preferred doctors and hospitals for your care, and you don't need a referral to see a specialist. You will still have coverage if you choose to get health care outside your PPO plan's network, but you may have to pay more for that coverage. As a member of an HMO plan or health maintenance organization, you have access to a preferred group of doctors and hospitals that provide your health care. This is called your network. In most cases, you are restricted to only those doctors and hospitals in the network. If you choose to get health care outside your HMO's plan network, you may have to pay the full cost. Now, let's talk about Medicare Part D, prescription drug coverage. You will need to purchase a separate Medicare Part D prescription drug plan if you choose Original Medicare for your health care plan. Because Medicare Part D has 3 different phases, your prescription drug costs may change depending upon the phase of coverage you're in. Those phases are a deductible period, initial coverage period, and catastrophic coverage. Medicare has made changes to how all Part D prescription drug plans work in 2025. Let's discuss a couple of the changes. The first is the coverage gap. It has been eliminated, so say goodbye to the donut hole. The second is that the annual out-of-pocket spending cap has been reduced to $2,000, which will help manage medication costs. We hope this video has helped you see a clearer path to your Medicare decision. From the entire team at Clover Health, thanks for watching.